Welcome to today's episode of Raising Healthy Kids with Dr. Bumz. I am Dr. Bumi Fake Udogo. On today's episode, we will be talking about a fairly common condition that occurs in children, which often gives parents genuine concern or even make them feel helpless in some situations. I'll give you an example. A mother brought her 4-year-old son to my clinic and was quite distraught about the fact that he had been coughing recurrently and having excessive eye discharge, sneezes quite often in the morning when he wakes up. And she had gone to several doctors, had several treatments for her son, and yet there was no end in sight. The symptoms just kept occurring over and over. Another parent who had just introduced complementary feeding came suddenly to see me to talk about the fact that they noticed hoarseness of voice after the child had taken some pap that contained nuts. I think that by now you should have an idea of what we're going to talk about, but not to worry, we'll dive into the main topic for today. Stay with me. Today we'll be talking about allergic conditions in children, how it impacts on them, on their quality of life, and everything that has to do with them. Remember, we want to raise healthy kids, and we want them to be just fine and perfectly healthy. Allergic conditions or allergies are generally exaggerated reactions of the body's immune system to substances that usually should not cause any harm. In children, allergic conditions have now been found to become more common and can actually affect the quality of life, school performance, and the overall health of children. And that is why it is important to arm yourselves with information that will help to either prevent or control allergic conditions in your child. I would run through a few of allergic conditions and some common symptoms that may be associated with these conditions. Allergic rhinitis usually presents with sneezing, just as we talked about earlier in the mother of the 4-year-olds, and runny nose, blocked nose, bronchial asthma. You would have heard about that terminology. Usually presents with recurrent coughing, wheezing, shortness of breath, chest tightness, difficulty with breathing. Atopic dermatitis, which is also known as eczema, could present with itchy, dry skin, inflamed skin, hives, wheals, and all sorts of skin manifestations. Allergic conjunctivitis, which is usually associated with swollen eyes, redness of the eyes, itchiness, watery eyes. You just note that the child keeps rubbing on the eyes ceaselessly. There are also allergic reactions to some insect stings, which could manifest as swelling, rash, or even severe anaphylaxis. There are also allergies to some food types, which could present with vomiting, diarrhea, bloatiness, and some of the gastrointestinal, abdominal manifestations. What could be triggers of this condition and these symptoms that we notice in children with allergies? It could be from the environment. Things like dust mites, dust, pollens, moles, especially in the living area, animal danders, furs from toys or from furry animals. When children are exposed to these environmental triggers, they can actually develop the symptoms that we highlighted. And then weather conditions, irritants like cold air, smoke, strong perfumes, insecticides, fumigating agents could also be an irritant and trigger some of these reactions. Insect stings, like we talked about, bees, wasps, and then some food products such as milk, eggs, peanuts, shellfish, soy, wheat. This list is actually inexhaustible. There are some times that even when a child takes some medications, could develop allergic reactions to these medications. Some other signs and symptoms that we may notice from allergic conditions would include itchy, hoarse throats, like the child that had been given nuts in the food, skin rashes, hives, wheals when the child comes in contact with environmental factors, swellings of the lips, of the eyes, of the face, or a particular part of the body, which happens suddenly, may even be painless, but you will notice that it happens very rapidly, and it's quite a scary moment for both parents and children. At times, there could be difficulty with breathing, wheezing, especially when it has to do with asthma. Other associated signs, especially from food allergies, would include abdominal pain, bloating. The child is refusing some certain foods. You will just notice over and over that this child particularly gets bloated or starts to have diarrhea or has some episodes of vomiting after ingesting some particular foods. These are all symptoms and pointers towards allergic conditions in children. There are a few basic things that we can do at home to prevent allergic conditions from occurring or to control the symptoms of these conditions. You want to keep the home dust-free. Frequent cleaning of the play areas, of the living areas, of the bedrooms. Frequent cleaning of the walls to make sure that there are no molds. This mother of the 4-year-old boy that I talked about actually went back to her house and discovered that there was actually patches of mold in the son's bedroom. And after that was taken care of and the curtains were washed and thoroughly ironed, she noticed that those symptoms actually stopped over the next 2 to 3 weeks. And in addition to other modalities of management that we gave, the child actually became well, active, and had no more symptoms as the child had presented with earlier. You want to avoid known triggers. When you have identified certain triggers, as we enumerated earlier, then you want to avoid as much as possible those triggers. You want to also consider changing the beddings very frequently, washing and making sure to air dry these beddings and toys that these children use. Avoid furry materials as much as possible for the beddings, for the toys, and items that children come in contact with very frequently, especially when you have noticed that these could trigger allergic reactions for the child. Try to keep pets out of the sleeping areas and also keep windows closed as much as possible during the high pollen seasons. Avoid strong perfumes, sprays, and avoid as much as possible exposure to smoke or to fumes that come from the kitchen during your culinary activities. There are major ways that allergic conditions can be managed in children. It could be medical. It could just be by adjusting the home environment, as talked about earlier. In medical management, please make sure to seek the advice of the healthcare practitioner or an allergy specialist or even a pediatrician to give a guide on what medications are appropriate for your child, for the age, and also for the condition that your child faces. You may need to give your child some syrups, some eye drops, some nasal sprays and drops, depending on what the allergic condition is. You may also need to apply some topical creams, and all this can be given to your child safely especially under the supervision of the pediatrician or the allergy specialist. There are sometimes emergency management is required in which epinephrine autoinjector can be given quickly, especially when you have cases of anaphylactic reactions. And then ensure regular follow-up visits with the pediatrician and also the allergy specialist for your child to stay well and have adequate control even when your child has allergic conditions. Continuous education. You can also teach your child on thoroughly avoiding trigger factors or controlling their exposure to trigger factors, or even quick first aid management, especially when they have been exposed to some triggers that they know would lead to symptoms of allergic conditions. You can also teach people who are in charge of your children when you are not available, such as the teachers, nannies, family members, how to quickly give first aid care when your child manifests allergic reactions or manifests allergic symptoms or has been exposed to a known trigger, to prevent the child from exhibiting the allergic condition. Remember that allergies can actually be managed effectively with early detection, avoidance of triggers, and then proper treatment when the conditions are present. There could be severe reactions, which we also call anaphylaxis. These are life-threatening, and you need to take your child to the hospital immediately for emergency care. Support from parents, from teachers, and everyone who is in charge of the care of the child is crucial for the child's well-being, especially a child who has been diagnosed with a certain allergic condition. And then at the end of the day, you would have a child that lives very well and has a good quality of life without having to miss school, having to get admitted in the hospital frequently, or having to present to the hospital frequently because of these symptoms. So prevention and control are key in managing allergic conditions in children. Welcome to the question and answer segment. Let's take a deep dive. Sensitivity and allergic reactions are actually very similar. There may not be a way to differentiate, but you can seek the advice of the healthcare practitioner, the pediatrician, an allergy specialist to give you a better guide so that you do not take any situation for granted and miss any opportunity to keep the allergic condition prevented or controlled. Oh yes, it is possible. It's always a possibility, especially if the child has been introduced to something new or something that the child has not taken or has not been exposed to in a very, very long time. So as much as possible, you can avoid processed foods, which could contain preservatives, which can stimulate allergic conditions in your child. But even if you're going to do such, look out for symptoms suggesting allergic conditions. And if there are those kind of symptoms, seek the help of the pediatrician or the allergic specialist for a better guide on what to do. Or stop those kind of foods if you are not comfortable until you are able to take your child to the healthcare practitioner. remember to readjust the condition of the home. The environmental factors need to be considered, need to be adjusted. Make your home dust-free. Avoid fumes, sprays that could trigger allergic symptoms, especially for those children that have respiratory symptoms. Try to avoid floors, rug carpets. If you can make them tiles, especially in the areas where the children stay, it is better. And also, if you notice that your child reacts to certain foods, please try to keep your child away from such foods until you have the advice of the pediatrician or the allergy specialist or even the dietitian to recommend the child on such food materials. Generally, when you are able to adjust these conditions, your child who has allergic conditions will be able to stay healthy and free from symptoms. For children who are known to experience or to exhibit severe allergic conditions, especially those that are associated with sudden onset difficulty with breathing, sudden onset shortness of breath, sudden onset chest tightness, those ones are candidates of epinephrine auto-injectors, and they should be taught how to use it. However, if they are very young, infants and young children who will not be able to administer it by themselves, then the caregivers should be informed about it and taught how to use it. There are some other conditions that will warrant a child having an epinephrine auto-injector, and these would be advised by the pediatrician or the allergy specialist, as the case may be. No, not necessarily. There are some allergic conditions that children would continue to have until their adolescent and adult life. Not in all cases. A small amount may cause a life-threatening symptom in some cases. So it's not to be overlooked, please. No, not at all. Antihistamines are much milder and may not be able to take care of that life-threatening situation. So they have their different roles, and one should not be interchanged for the other. And now we've come to the end of today's episode with Raising Healthy Kids with Dr. Bumz. Remember that we talked about allergic conditions in children. And this topic is very broad, and I just attempted to give you a few key messages. So if you have questions, remember to send a DM or send an email, and we'll do our best to give you solutions that best works for you. Remember, early diagnosis and laboratory investigations, things that can also help to prevent and control allergic conditions in children who have been diagnosed to have allergic conditions, are very important in giving these children a good quality of life. Remember to like, follow, and share with your friends and family. Also remember to subscribe to our social media channels, and also hit the notification bell so you'll be alerted when the next episode drops. Until the next episode, I remain your one and only Dr. Bumz. Bye!